Hi, this is Galina, and welcome to the Animal Wellness Podcast. Today, we will be starting at the very beginning and speaking with Elaine Cebuliak, the Director of Animal Wellness Practice. Elaine has a specialty in dentistry and holistic animal wellness. So thank you, Elaine, for joining us today.
Yes, thanks for organizing this, Galina. I've been asked by many clients to develop a podcast so that we can allow lots of people, instead of the one-on-one in the consult room, to gain some of the knowledge that I've gleaned over many years. And I've been meaning to do this for such a long time, so thank you for helping organize it.
Wonderful.
So yeah, let's get started. What would you like to ask me?
So, Elaine, can you tell us a bit more about yourself and what led you to want to open animal wellness and animal practice in general?
Yes, okay. Well, let's see. I grew up in Hawaii, hence I've got a bit of an accent. It's always been part Australian and part American, I think, which can be a bit confusing when I pronounce the R's, and sometimes I have to spell some words out or write them down. I've always been interested in animals. I did have a puppy when I was a kid, and I had birds. I had a little budgie that was quite devoted to me when I was in junior, intermediate school and high school. And then when I came to Australia as a 15-year-old and had to finish my grade 11 and 12, I chose a lot of science subjects, including biology and zoology, and I topped the class at my high school. And that led to, what should I do? My dad was a chiropractor, so I was always aware that there was other forms of health care that were available. And I was contemplating medicine, but at the time, my brother, who was a couple of years older than I, wanted to study medicine, and the University of Queensland, where we ended up, made it a really difficult time for him. Both my brother and I were quite academic at school, and it seemed as though they didn't want many more Americans to join into the medical faculty. And it was a free university at that time. We were very lucky back in 1975 that the Queensland University had pretty much free scholarships for academic people to join. And I remember my dad trying to get my brother into that school, but they put him in a category with people that had already done a Bachelor of Science, and he'd only done 2 years at the University of Hawaii. So they wouldn't let him in, but they let him into dentistry. And I had contemplated studying dentistry at the time when I graduated high school too, but vet science just seemed like more fun at the time. And that's kind of more or less how I got in. I had high enough marks to do whatever, but it ended up going into vet school. It was a little bit more complicated than that, because the transition as a 15-year-old over from America to Australian education system was a bit rocky, and the guidance counsellor, I think, hadn't met many American students who excelled academically. So it was fortunate that I was able to do that, but it did mean that the counsellor had put me off studying physics, maths 1, maths 2, chemistry, biology, zoology, like an extra load, and he thought that was too hard for a new migrant to actually take on, so convinced me to actually drop physics and chemistry, which turned out to be prerequisites that I needed to get into vet school. So after I came first in most of my subjects, I realized that that was a disadvantage to get into medicine or vet. So I talked to the physics and the chemistry teachers, and they let me study on my own during my lunch hour. So I ended up doing grade 11 and grade 12 chemistry and physics more or less at the same time, sort of halfway through grade 11 and into grade 12. And then the dean of the faculty of the vet school let me in based on my results and the fact that I had enough gumption to ask for extra consideration, because basically the grade 11 chemistry and physics was just not really on the schedule. It was just me studying it on my own. And that's how it worked. That's how I got in. And with regards to opening the vet practice, this is not the first practice that I opened. When I was in final year vet school, I met my husband-to-be, and he's a Canadian doctor who was a fairly new graduate, having done his internship, and he was traveling around the world, and was he liked the climate of Queensland and Australia, and I guess he liked me a lot. So he decided that he'd want to stay and work, and then that involved getting permanent resident status for him. By this stage, I was already a permanent resident, and that was no trouble. But for him to apply to work and stay in Australia was going to take longer than his visa allowed. So it worked out that he and I could both work in New Zealand. So we went over to New Zealand as soon as I graduated, and we worked there for a while, and then came back and ended up in central Queensland. That provided the opportunity for myself and my husband to both work in our new professions. So we raised 2 children there, and during that time I continued with my interest in veterinary dentistry, and it was quite new in those days. We had about half a lecture on dentistry, and vet science covers a lot of species and a lot of topics. You know, you graduate with knowledge about anesthesiology and orthopedics and dermatology and internal medicine and oncology. There's a lot of areas and a lot of species, but dentistry in the course was a very, very small part. So I knew some extraction techniques, a little bit of periodontitis, etc. So, but I had my brother's textbooks, and when I graduated, I realized that there was a lot more to dentistry than we were taught. So I hung out with the local dental technician who lived around the corner from us, and at that time there was very little in the field of expertise in veterinary dentistry, so we all kind of invented stuff around the same time. I did some orthodontics with the help of the dental technician, the human one, and I also had them help me organize some fillings and experimented in how to do root canals way back before anybody was doing any of that stuff. And then the course developed with the Australian New Zealand College of Veterinary Science is the specialist body where people that learn to specialize in their area in veterinary science can get some extra training and get some further recognition. So, yeah. Sorry?
Trailblazer.
Yeah, pretty much. Yeah. It was a good idea at the time. And so around that time, about 3 or 4 other vets in this country were also developing dentistry. Gary Wilson was one of them. And every now and again, I'd see some stuff that he was doing that I was also developing at the same time. And that became this small group of mostly men that were doing that sort of work. And in the year 2000, there became a written exam for veterinary dentistry, which I sat for and passed. These exams involved anesthesia and internal medicine, as well as dental techniques, etc. So yeah, I was definitely one of the early ones that developed veterinary dentistry. I actually wrote the course for the veterinary nurses in dentistry. I sat down and wrote that book. It took me about 3 weeks sitting there. And that was about the time where my son was getting married, and I asked my husband to write a little speech, and it took him just as long to write the speech as it took me to write the book. He was like, "What? You wrote a book in 3 weeks?" But yeah, that's all I did. Sometimes when I get focused on something, that's all I do. So I've taught a lot of the vets that are now doing dentistry. Way back then, I used to help run the workshops, which would be about measuring teeth, and you have to, look at each tooth individually and measure the periodontal pocket around them. You have to learn to number them. And there are certain techniques that people need to know about, extraction techniques, such as breaking their periodontal ligament by stretching it slowly so that you don't cause too much trauma to the jaw. And then dental x-rays came in a few years after that. So way back then we were using the ordinary X-ray machines and putting the anesthetized patient on a pillow or something so that you would get a close film focal distance using an ordinary X-ray machine and an open mouth technique. And then we started to use hand-developed dental films in little light boxes. I've got one I can show you when you're back at work again. And then that turned into digital X-rays. So all of this is quite new, these techniques. I think I got my first digital X-ray dental system about 11 years ago. So I was one of the first to have a handheld dental X-ray machine. And the one that I did buy from South Korea was also a world-leading one. It has a flip screen, an LED screen, sort of like a camera. So you take a picture and you can look at the screen immediately. You don't have to develop it. There were not as many pixels as the one that we've got now. There's more JPEGs. You can see much more detail now in the one that we're using, which is a CR system as opposed to a DR system. So yeah, dentistry's come a long way. I'm really proud of the way that I've helped develop that industry within the veterinary profession, and I'm happy that I can continue to mentor and help newbie vets. And I do a fair bit of that online through Facebook, through these chat groups that we've got with veterinarians. You know, it's a tough profession and it's nice to be able to give back a bit, but sometimes I do feel a little bit time poor. So how did I open the animal wellness practice? That's a bit more of a story. So I was developing my interest in acupuncture way back when I was a vet student. I remember watching President Nixon in America opening up the borders between China for trade. And I remembered watching movies on television about a woman that was having a cesarean section and having electroacupuncture and apparently not having any pain when they sliced open her belly to take the baby out. I thought, whoa, that's cool. So in final year, way back in 1979, I started researching acupuncture, and that's before the internet. So I would go to the Griffith University Library that had Asian studies, and I found there were tons of scientific articles on acupuncture. It was amazing, and I really liked the library there. And so my final year assignment was the use of electrostim acupuncture for providing analgesia in the bitch. And I also spent some time with an acupuncturist to learn basic acupuncture techniques and figure out how that might happen. So in the end, I had graduated with a fair bit of knowledge on acupuncture, but at that stage, it hadn't actually reached a system of education to learn animal acupuncture so much. And since then, there's quite a few colleges that do teach it. So you can study animal acupuncture if you're a vet through the International Vet Acupuncture Society, or the IVAS course, which is the one that I did eventually study through, and I've also helped teach through that college. And the other college is the Chi Institute that happened out of Florida but is now international. And a couple of years ago, I was invited to help teach the acupuncture course in Indonesia, where I have lots of connections, and that was also really fun in Bali. I really appreciate being involved in those groups. So because my interest in acupuncture and holistic medicine and the fact that I understood chiropractic and rehabilitation techniques were not part of my course, I continued to nurse those interests. And then I just kept taking subjects at the local human colleges that were naturopath college at the Australian Institute of Applied Science. And I'd take like herbal medicine 1, herbal medicine 2, herbal medicine 3, herbal medicine 4, and nutrition and a few other subjects. And then the college said to me, you could actually become a naturopath, you just have to do the clinic and a couple more nutrition courses. And so I did end up doing that. And on the way, I also picked up advanced diplomas in remedial massage and Twain types of techniques and Bowen type therapies. So then I developed that into an animal massage course, which I do teach once or twice a year. But since COVID, of course, I've not planned to teach that until we know about safe distances and those sorts of things. So far, touch wood, Queensland's doing really well, and I might be able to run that course in the next few weeks or months. We do have people waiting to do it, so that will be good. And because of those experiences and my knowledge about pharmaceuticals and also understanding immunology and not being on par with vaccinating annually, knowing that that can set off immunological diseases and can cause some harm, and that we really should only be vaccinating to effect of what is needed. So with dogs, for instance, that's pretty much one vaccine after the age of around 12 to 14 weeks, which provides a good antibody titer for most of those animals for at least 5 to 7 years, if not for life. So that's how I wanted to practice, knowing that I want to do as less harm to the patient, and I wanted to be able to help support the body for better health rather than doing things that seem to be against my better judgment. So that meant it's a bit hard to fit into a standard practice that way. And even though I was offered jobs at specialist centres, I didn't totally agree with the way that things were happening within them from a medical point of view. So I think I would have found it hard. One practice in Sydney offered me a position there, but also my family lives in Queensland. We didn't want to move. So I thought it was probably better just to open my own practice. So that's what I ended up doing. So this is actually the fourth practice that I've opened. I had 2 in Gladstone when we lived in central Queensland, which I sold so that we could move down so that my kids could go to a high school. There wasn't a high school when we lived there. They would have had to go off to boarding school or a distance school that probably wouldn't have been the best for their education. So yeah, so along the way raised the 2 kids and opened some practices. Yeah, so that's it kind of in a nutshell. Yeah.
That sounds really fascinating. So family first always. So what you said before about being one of the trailblazers in dental medicine for animals, how would you say that dental disease affects animals' health, maybe in ways we might not even be aware of? What would you say to that?
It's a bit sneaky because the teeth are covered by the lips, and unless you know what you're looking for, the dental disease often goes missed. And even in general practice, although I do think vets are getting a lot better at that, but broken teeth, chips and fractures off of the crowns of teeth, and periodontal disease are really quite common. So pretty much any animal over the age of 2 can have, and even the younger ones can have some form of dental disease. So that's why we actually do offer a free dental check on Tuesdays and Thursdays. And we try to teach people, to have a look and to also teach them gold standards. It's actually a really good idea to get your puppy used to having the mouth examined on a daily basis, and also to teach them to accept some toothbrushing and then supervised naturally abrasive sort of food to help clear off the plaque. The types of diseases and complications that you can get from bad teeth can be heart disease, kidney disease, liver disease, general inflammation, and it's painful, not to mention the smell. I mean, animals have a 300 times more sensitive nose for smell than we do, so imagine living with that and smelling that disgusting, pussy, purulent, discharged, rotten, calculus-laden teeth, I don't understand how people can have their dog kiss them and breathe over them when they've got some really rotten teeth. I mean, we've seen really disgusting things. And routinely, when we take out the damaged, infected teeth, once the socket's open, we have really good pain relief nowadays. We didn't have so much when I graduated back in 1981, but we do now. We do recognize pain, and we do have better analgesics now than we used to. Plus, our practice has Chinese herbs like corydalis that's a little bit like an opioid, and it doesn't cause kidney disease or liver disease. We also have the doggy aspirins, of course, but we have things that if the animals liver or kidneys compromised, we have other methods of pain relief. We use PEA quite a lot now, which is palmitoyl ethanolamide, and that binds to the cannabinoid receptors, so that we can provide pre-operative analgesia and post-operative analgesia quite easily, and we can do quite a lot to fix up those animals' mouths. And routinely, when you get rid of or extract diseased teeth and the gums heal over, often those dogs that are like really old and slow become puppy again because they're not in chronic pain. And the chronic pain is hidden because it's inside the mouth. And then if you think about it, if you can't chew or push down on that area because your teeth are sore, you could have a headache, you probably don't eat as well as you should, or you eat more because you're always asking for food, because eating more actually produces more of that serotonin and that dopamine, and it takes away the pain temporarily. But then they don't want to move so much, they just lie, in the corner. And they're often new puppies again, even like a 12-year-old or 13-year-old, you take out a broken tooth and some rotten infected teeth, and they're just so much happier, and quality of life is increased. Quite often we'll have people say, oh, but the dog's really old and he's got a heart murmur, and we have really good anesthetics now, so we very rarely see any complications from our anesthetics. And age is not a disease, the teeth are a disease. So if you have a 12-year-old dog and it's got rotten teeth, and then you remove it, those rotten teeth gone will make the dog so much happier, and the quality of life for however long he's got after that is well worth it. And very often they live for years after that too. So yeah, so that's what we do specialize at our practice with, dentistry in all different ways, mostly periodontal disease, but we have the ability to do fillings and root canals and orthodontics. So and fracture repairs. We've got some really good tools to do acrylic fixes for those, which are, I think, the fractures of the mouth are really dental territory. It's not really orthopedic territory. So orthopods are really good at fixing, say, fractured legs and cruciate repairs, but the mouth really belongs to a dentist. So anything in that area, even oronasal surgeries, that's kind of, what we do.
So pretty soon we'll have implants for dogs and cats.
Yeah, look, they do exist, but the problem is the reason that you're losing those teeth is usually periodontal disease, which means that the infection has gone around the tooth, eaten through into the root, and caused some damage to the bone structure. So a dog or a cat with no teeth is a happier dog or cat than one with broken and infected teeth, and they can live a long time without teeth, as can people. And they don't necessarily need to have a whole bunch of teeth too, but we do try to save, say, the canines, because the canines are important teeth. The upper canines keep the lip in the right position, and the lower canines keep the tongue from falling out. So if you at least try and save those ones, that's really quite important. Incisors, they're not as important. The back molars and premolars, they're fairly important. If you can keep those ones, they can use them for chewing. But look, if they're 12 or 13 years old and there's a lot of infected teeth and you're able to remove them, dogs will do very well on stews and well-cooked sort of bone broth type of diet with stewed vegetables. And that's very healthful. So you don't have to worry so much about losing some teeth. And I know a lot of people are worried about, don't take any teeth out if you don't have to. Well, we don't take teeth out that you don't have to take them out, but it's a bit like if you've got a spur or a thorn in your finger. If it's in your finger and it's throbbing and it's infected around the thorn, you need to take it out. It's, you could give yourself antibiotics and pain relief if you've got a stick sticking in your finger, but it's still infected and it still needs to be removed. So that's how it is when you've got a really badly infected tooth. It's throbbing, it's sitting in there. You can certainly give antibiotics, which a lot of, dogs that we see in particular, or even cats, come in and they've had, say, facial abscesses, which have been due to a broken tooth, and they've gone to other vets and they've had, antibiotics and pain relief. But you've really got to get to the source of the problem. You know, if it's a retained broken root underneath the gum line, you need to take a dental x-ray, you need to go digging, you need to take that root out and get to the source of the abscess. Yeah.
That sounds awesome and fascinating. That actually leads us to the next topic we're going to be doing next week, which is nutrition for dogs and cats. But for now, we've run out of time. So thank you so much, Elaine. And it was a pleasure having you in the show.
Yeah, thanks again for organizing it. We look forward to doing another one soon. Thank you.
Thank you, Elaine. Have a great day. And thank you, everyone, for listening to the Animal Podcast. Have a great day.